My name is Dr. Cynthia. I'm a breast surgical oncologist working here at Maryland Oncology Hematology. I was born in Florida but lived in about 7 different states before landing in Maryland, and I've been in the area since then. When I was 15, I worked for a plastic surgeon, just doing inventory and things, and he had an ambulatory surgical center in his office, and I was allowed to watch from the window, and that's when I decided I want to be a surgeon. So I went into college knowing what I wanted to do. And at the time, I was the only fluent Spanish-speaking surgeon and female surgeon in Montgomery County. And so the patients just kind of flocked to me, and my practice just ended up being mostly breast. And then I had the opportunity to just do breast surgery. And I think seeing, number one, the relief in the patient's eyes when I was able to communicate with them in their own language, you can just tell they are not listening a lot once you start going into everything. Especially, God forbid, they need chemo, they need this or that. So I like to do diagrams. We give them a folder and I'll say, just sit with it, write down all your questions. I always tell them, you'll have at least 10 questions by the time you get to the car that you didn't ask me. Write it all down. This is the overview, and when you come back with whatever other imaging or biopsies, then we'll go over everything again. It is not just breast cancer, the same for everyone. We will tailor what we need for your specific care. I'm very clear on what the next steps are. Communication is incredibly important. If I can't do this, then my navigator will get to you, my assistant will get to you. These are your next steps. So I usually will try to say the next 2 steps only, because sometimes there's so much going down the line, but I'll say the next step is get this image schedule, and then you're gonna see me, and you don't have to worry about anything until after that. I value the confidence the trust they give me. I value that so much. Their gratitude. I try to make it a point, if I can, to walk into the operating room with the patient, and I will hold their hand until they go to sleep. So, you walk into the operating room, they don't know anyone except for me, because there's anesthesiologists, there's nurses, there's techs, everyone's putting something somewhere. And I'll just say, just look at me. It's okay. I hold their hand, and then they go to sleep. I think with clear communication, and again, making sure everyone knows they're an individual. Breast cancer is breast cancer, but it's your first time, it's that patient's first go around, and I think just making sure that they understand that they're an individual. Follow up, making sure my team follows up when they're supposed to follow up, because if things fall through the cracks, that completely cuts the trust. Maryland Oncology Hematology, the folks that I work with, the medical oncologists, the radiation oncologists, the nurse navigators, we have a full team ready to do what they need us to do for them. I just want them to know that we will get them through whatever's coming up. That is going to be difficult. I'm not going to lie, it's a scary thing, but we will be there with them every step of the way. Again, I'll tell them, just start praying now, because that's your job, and we'll get them through the rest of it.